Diolch, Llywydd. Minister Trefnydd, could we have a statement from the Health Minister on whether he will ask the JCVI, the Joint Council for Vaccinations, to add frontline funeral workers and mortuary technicians and embalmers to the list of frontline healthcare staff in Wales for whom occupational immunisation with a COVID-19 vaccination is recommended? As I understand, Northern Ireland are likely to do so within the coming days, and indeed as Scotland and England have done in recent days. Could we also have a statement on pay for experienced supply teachers? There's been a welcome framework put in place in Wales to ensure that all supply teachers are paid to at least M1, the entrance level salary, and it's a big improvement for many. However, for the more experienced teachers, including a constituent of mine who is on the U1 level, this is quite a bit under what they've trained for and what they've gained experience over many years for. If supply teachers are employed directly by councils, they're paid to the scale that they are on. But the fear is that supply agencies are taking over so much that schools are not using supply pools themselves anymore. So experienced teachers are earning much less than they're qualified for. And a statement, Minister, could also clarify arrangements for supply teachers through furlough. There are many agencies who are still deciding whether or not to furlough their supply staff. As being a supply teacher depends entirely on day-to-day work, the supply agencies are finding the furlough process quite difficult, and of course this impacts then on their supply teachers too. So I'd welcome those two statements, please.
Thank you for raising both of those issues this afternoon. It is the case that the JCVI guidance issued on the 2nd of December states that frontline funeral operatives and mortuary technicians or embalmers are both at risk of exposure, and it has been agreed now that those in the funeral sector who would require PPE to undertake their role would come under cohort 2 and therefore should be vaccinated. So we would ask that any of those working in that industry to pass their information on to the local health board to ensure that the vaccination is offered to them at the appropriate time. And on the second issue relating to pay for supply teachers, I'll write to you on that matter in respect of my responsibilities for procurement to provide a detailed response.